get started here. If you just came in, if you could please put your name and your facility into the chat. We'll take note of attendance. And I'll ask again at the end, but we'll go ahead and get started. We're about 3 afternoon, Monday, May 8th, the statewide lab advisory meeting. So we're going to record the meeting. We will post it. I know we've been slow about posting meetings recently. We've been working hard on updating our website. If there's anyone here who has a new staff introductions, anyone new on the teams? Feel free to shout out. Okay, we'll move on. So we'll move on to laboratory topics. Number one on our list here is, like I said, we're doing the new website. We sent out last week a survey to get some input, some things that, laboratorians, people who are going to use our website, what they would like to see, and suggestions. If you haven't already, we ask that you just please fill that out. It's quick, and if you didn't receive the survey, if you could just email either Becky or myself, we can send you a link to it. We're trying to work out some bugs in our mass communications, the way we send things out. The reportable disease guide was updated last week. It was brought to our attention that on there, we were actually asking for the non-Shiga hemorrhagic E. coli, the EAEC, the EPEC, and the EHEC. Those do not need to be sent into NPHL when they're positive by stool panel, GIP panel. We are looking for the Shiga toxin positive, E. coli or Shigella. So that was updated. I sent out an email and attached that to everyone last week. It's been posted on the website, the updated version. If you want me to send you a copy of it, just go ahead and email me about that as well.
Ben, do we need to update it on our site too then?
It was, you have.
Or do we have the right one up?
Well, you might, if you have a separate link to the Nebraska Reportable Diseases, Title 173, the green and yellow sheet.
Yeah, we have that on our website.
Okay, I'll send you the new one.
Okay, thanks.
Yeah, a very slight correction, but I'll send it to you.
Okay.
Thank you. Okay, so that's been updated. Those will be updated wherever you can find them. A note here, the 2023 Antimicrobial Stewardship Summit is Friday, June 2nd. Registration is available at the UNMC website for those who wish to attend. If you're having trouble finding it, I can also send you a link for that. Just email me. And the World Health Organization in the US are calling an end to the public health emergency for COVID-19. The US actually end on Thursday, the 11th. And Robin said that she had a note about this. Robin?
Yes, hello everybody. So for laboratory reporting for COVID moving forward after Friday, all facilities that are sending electronic lab reporting messages, ELR, will continue to be required, will continue to send positive and negative COVID results for all testing methods, serology, antigen, and PCR. So that note will be posted on our website, hopefully by the end of tomorrow, but thought I'd give you guys all the an update today. And if you have any questions, feel free to reach out to me or feel free to reach out to me. And we can go over that. So that means that clinics and other facilities that are not sending ELR do not have to report. But I believe we will be also adding COVID to our weekly survey report if you are not doing ELR. That won't happen this year because it's pretty much done with the season, but if you are not doing ELR, we'll probably be adding COVID to that weekly report as well. So you can be on the lookout for that, which would mean you report your total number tests performed, total number of positives. Does anybody have any questions? Okay. And coronavirus was already reportable before the pandemic, and so it's not going to really change anything, and we don't have to really change anything moving forward. It's just back to normal with influenza RSV type reporting.
Thanks, Robin. Another thing of note here is if you're testing for COVID-19 using the emergency validation, we might have to keep an eye on that. Emily, if you could shed a little more light on the situation with emergency use. I think I saw her here.
Hello, sorry. Yes, emergency use authorization. So if the assay you are utilizing to do your testing is under an EUA or emergency use authorization from FDA, please monitor the status of that closely moving forward, because the FDA can rescind that at any point. That goes with any assay you may be using that is under emergency use authorization. So just an FYI for all you regulatory people out there to watch your assays.
Thanks, Emily. So then just a quick note, it's getting warmer. Summer's right around the corner. Spring has sprung. All of our woodland creatures are coming out of their holes. We have to start watching out for some of the warmer weather BT organisms, tularemia, anthracis. So if you need a quick update, we do have a rule out review posted to the website. We just did our LPX and Nebraska state challenge set reviews, and so we kind of discuss some of the testing algorithms, rule in and rule outs. Those are also posted to the website. Really slow growing gram negative rods, really watch out for. Fast growing large gram positive rods, keep an eye out for. Gram negative rods that don't grow well on McConkey. Just a brief reminder, we're going to start seeing more of those. And that's really all I have for big laboratory topics right now. So we can move on to the NPHL client services, and if we're experiencing any issues from last month, if anyone has anything there. No issues, no news is good news.
I don't have any issues reported to me regarding public health. So that's good.
That's good. Everyone's getting along.
Yeah, well, so we are going to have some interface updates for those sites that are interfaced through, I think Charles Drew, One World, Lincoln Lancaster. There's going to be some interface changes with, I think is it Healthland, the company that manages their interface for them. So I can't recall what the issue was, but it's going to hopefully improve the communication. And I think it has something to do with an upgrade. So that's going to be happening here soon.
Okay. Thank you. Do we have any outbreak updates from last meeting? If anyone can speak to that. Nothing that comes to mind. Again, outbreaks, no news is good news. So, well, I guess, yeah, we'll just move into all the outbreak updates. So Ishrat with our hospital acquired infections.
Yeah, we currently don't have any updates, any outbreaks, but we just recently completed our 4-year analysis of all the CPCREs and CRPAs. And one thing that we noticed that in last year, in 2022, there was a very drastic increase of CREs and CRPAs. And we actually looked at different types of labs, and we also looked at all the labs that are sending it consistently, and it looks like the volume did go up. So we are going to show you graphs in some of the meetings next time. We are still validating the data. So that is one. And the other thing is that a couple of us are going to the CDC's antibiotic resistant laboratory regional lab in Minnesota for a 2-day conference. So we hope to bring back some updates. Thank you.
Thanks, Ishrat. So are there updates to the COVID-19? Other than
Yeah, I can give brief update on that one. So total positive cases that have been reported to us is 583,592. That's averaging 54 cases per day, and about 880 tests per day are being reported to us on an average. Hospitalizations numbers are going down and are in lower 50s, and we have 5,096 deaths so far from COVID. That's all I have.
Thanks. Derek with RSV and flu. Winding down.
Yep. So thankfully, not too much to report out in RSV and flu world. Activity continues to be low as we near the end of this current surveillance season. Just a couple reminders. First, just a reminder that if you do see any influenza positives now and over the summer, to still please submit those. Also, our cadence for our respiratory report will be changing from weekly to monthly starting in the summer months. So about this time, from a month from now, we'll be doing monthly reports, then we'll change back to weekly cadence at the start of next surveillance season, or potentially earlier if RSV decides to be weird and show up early like it did this year. So other than that, that's about it. I'll pause if anyone has questions, or if Robin, you have anything else you want to add?
Nope, that's good. That's it. Yeah, and well, I guess we'll be coming upon fair season. So if you do have a positive, please try to encourage your providers to ask if they've had any swine exposure. If you have sick folks coming in with positive flu over the summertime.
Okay, so we'll move on to Brianna with the enteric outbreaks.
Hi there, can you hear me? Yep,
Yes.
okay, cool. Hi, just as we approach summer, just a reminder on submitting Cyclospora specimens to NPHL, and any Cyclospora detection, like on BioFire, that is also reportable. Typically, the peak season is like May through September, so just a reminder before we go into that season. And then additionally, we have a couple active Salmonella multi-state outbreaks linked to backyard poultry. So people buying little chicks and having them in their house and touching them. So just another reminder to submit any Salmonella specimens or isolates to NPHL as well.
Hey, Brianna, this is Pete. Do you see an increase after Easter when it comes to chicks?
Yeah, that's around end of April is when it kind of starts we start seeing a
No,
lot of
no.
people reporting chicken exposure, chicks,
Chicks.
going to Tractor Supply or something and buying the little baby chicks. And
Chicks for Easter just doesn't sound very good to me. I don't know.
yeah, there was an outbreak a while ago. I think it was in Douglas County where a daycare brought in little chicks for Easter time. Luckily, a lot of people did not get sick. I think it was just a few, but still, we were
Oh.
able to. I think that we were able to collect the chick incubator and get it tested, and it matched. I think it was
Cool.
back in like 2017, so it was a while ago. But
I think there's a warning sign to look at here, right?
yeah, and we send out a letter, it's like salmonella, poultry, and baby chicks to all the feed stores every year, right around Easter time. So that was already done in April. So
That's good. All right,
Mhm.
thank you.
no problem.
Thanks, Brianna. Any arbovirus updates, Jeff?
Yeah, this is actually more tick related. So in the last couple of weeks, we've sent out our annual tick-borne disease HONS, and actually what we've had a few questions on from some of the local health departments and some clinics and that reached out to them is about testing of ticks themselves for diagnostic purposes. So I just kind of want to, bring that up here real quick and just say that DHHS and CDC, we do not recommend testing of ticks that might be attached on people that come in for diagnostic purposes. There's a couple reasons for that. A lot of times, if the patient happens to be infected, they're probably going to develop symptoms before the results of the tick tests are even available, because there are commercial labs that will test your ticks for you. And so the thinking there is, if you do become, ill, if a patient does, we don't want them waiting for tick testing results before seeking healthcare treatment. Additionally, positive results, that might come from a tick that has been submitted doesn't necessarily mean that the person was infected by that tick. And then also on the flip side of that, negative results can lead to a false reassurance. So while that tick may have tested negative, there may have been a tick that was unknowingly attached that may have caused an infection. And so again, we don't want individuals waiting to seek treatment because of the tick testing results. Hey, I had a negative result, can't be a tick-borne disease, so they don't go in. We don't want that. And so that's why we don't recommend testing of ticks for diagnostic purposes. So I just wanted to bring that up because we've had a few local health departments since we sent out these HONS reach out just regarding that question. They've had some questions from some clinics. So if you get questions from some providers, reaching out to the lab asking that, just let them know that it's not recommended to test the ticks. Although if the patients want to pursue tick testing, they can search on Google and there are a number of labs that will test their ticks for them, but we don't recommend it. So I just wanted to bring that up.
Say, Jeff, how about we get sporadic cases of where people will send ticks to the laboratory for species identification?
That's fine. I don't have any problems with that because that can at least help a provider to maybe think about what maybe to look out for in terms of signs or symptoms.
Okay.
In some areas where you have a high incidence of Lyme disease, CDC does recommend some prophylactic treatment for patients that have been exposed to a black-legged tick in those areas. I know for stuff like Rocky Mountain spotted fever, though, they don't recommend prophylactic treatment because there's some studies showing that it may not actually prevent the infection. It may just actually slow down the onset of symptoms with that particular pathogen. So, stuff like that, it still might be nice to know what the tick species is, just so that they can, be aware of what this tick can transmit, as well as maybe pass that information along to the patients, letting them know, hey, watch out for, if these symptoms,
Okay.
pop up, certainly come, see your doctor, healthcare provider sooner
Okay.
rather than later. So yes,
Right.
identifying is perfectly fine. It's just testing them, isn't recommended.
Okay, very good. Thank you.
Thank you. TB testing. Kristen, any updates?
Yes. So I think I just have one update and it's regarding IGRAs. So we do right now with sort of updated guidelines, we can do IGRA testing on children under 2. So that does include the infant population in the state. especially being a low incidence state, we don't run into this a lot with contact investigations or if there is routine testing being done. But this is something that, has come up in the state, and I just want to pass it along that it is okay to do IGRA testing for infants. When we're looking at a recent contact to someone who has been around someone with infectious active TB, our under 5 crowd is at very high risk of progressing. And so we can get better accurate results with an IGRA. We definitely want to go that route. So just to keep people updated, we are seeing it, we are doing it, and we have seen positives in IGRAs in the 2 and under crowd in Nebraska. So I just wanted to pass that on, as I know we don't see a ton of this issue come up, but it is something that we can do if needed.
Say, Kristen, is there any updates on Ukrainian refugees and TB issues?
I think things have been pretty status quo for the moment. For many of you know, we did get some extra funding to support the Ukrainians. Most of that money has been put in Lincoln-Lancaster County Health Department with the highest Ukrainian population in the state. And then we did allocate some towards Douglas County Health Department. So we haven't seen tons of updates. Really, we have exhausted sort of educational efforts and done some outreach efforts. But we're not real. Our refugee program is very well because it does cover our IGRA testing for Ukrainian arrivals. So we really haven't used a lot of our funding for that purpose. But we are still having Ukrainians coming in. But I think I was on a webinar and CDC did say that they did not see as many TB issues as they thought they would among the Ukrainians. So I don't think they're as big, but I have gotten phone calls from across the state as far as Western Nebraska about Ukrainians arriving in their clinic, what to do, preventative treatment for latent TB infection. So it is an issue that we will continue to see as long as Ukrainians are coming in. And it is statewide where Ukrainians are resettling. However, the largest population does remain in Lincoln and Lancaster County.
Okay, all right, thank you.
Thank you. That's all I have.
Thank you very much. We'll move on to the STD program. Dana is our new point person there, but I don't know if I saw her in the. I don't know if she's with us today. And if not, we'll move on to lead testing.
Hello, we don't have any major updates today. Just a casual reminder that all lead tests are reportable, even the negative ones. And that's it for today.
Okay, great. Next up, LRNB suspected agents. I know the LPX survey was just done last month. I don't know if there's been anything going back to the BSL-3 besides that, Emily. Anything there?
Nothing exciting. Nope.
Okay, and then anything going on with LRNC other than leads?
No, thankfully it's quiet. We like to see LRN stay quiet.
Yes.
Something happens in LRNC, it's a big deal.
We do expect LRNB to get a little busier with Francisella rule out, so. Correct?
Absolutely. We will probably start seeing the uptick in Francisella and Bacillus rule outs here shortly, especially with this warmer weather, individuals
Right.
out mowing lawns, coming into contact with those little bunnies. So please keep an eye out for this organism, especially if you have a patient history that is a groundskeeper or someone who notes that they recently were out doing yard work.
I'd also add, don't forget about tick bite too.
Oh yeah, thanks, Jeff.
And exposure to cats. Feline tularemia seems to be an issue for us in our area.
Okay, just some quick notes on the laboratory training schedule. We're moving the Graham Stain Challenge that normally would have been sent out in August. We're moving back to September. And that is the same for the on-site training. that we had initially planned for the end of August. It was kids are going to be going back to school. It might be harder for some people to travel, so we're going to just push that back a little bit. Like I mentioned before, the LPX and the Nebraska Challenge Set reviews have been posted for your information under training and education. I don't think there's really anything else to talk about as far as laboratory training goes right now. So we'll open it up for any last comments or notes. And then again, yeah, if you haven't yet, please put your name and facility into the chat. But we'll do a little open mic here if anyone has anything to add. Okay, if not, the next meeting is Monday, June 12th. I'll send out reminders and agendas, but for all the DHHS people, if you want to hang out, and then all the laboratorians, you're free to go at this point. We hope to see you next month. Thank you.
Thanks, Ben.